Hey everybody. It has been 24 hours since the surgery. You can hear my silly lisp. Here's my teeth. Don't like them. Um, they're okay. I mean, they don't feel real bad. The bite's off, but I got to go back this week for him to adjust the bite. I was just too done to have him keep messing with it. I was just ready to come home, and I'll let the swelling go down, and then I'll go back and have him adjust my bite. There's a couple of spots you can't really see them. I don't know if that's normal on the temp, but there's one spot right in the middle of these two teeth that drive me crazy. There's no way I can live with that and go to work. And I need to wait and see how much my gums show when I smile, because I don't like the way the gums look. They look like they're peeling, but they're not. It's just not a very good finish on them at all. And I did have to pay for them, right? So I'm very swollen. My lip was huge this morning. It's gone down. My lips are super chapped. The surgery went well. I got there. They're all really nice over there at Radiance. And I took the pills and they went to work. I don't remember much of it. I got up. My husband came to get me around 3 or 4. It took a long time. And there was a couple of, or a student, or another dentist there that was visiting from like the Washington State area, that was going to speak at some event tomorrow that they're doing on implant dentistry. But they were all super nice, and I didn't. It didn't really hurt. My teeth don't hurt right now. What hurts, I think my gums are starting to get a little raw, but that could just be that they're sore. The swelling is really the most uncomfortable part because it makes my skin hot and tight, and he wants me to switch from cold compresses to warm compresses now to get the blood flowing. And the swelling is kind of going down, but I do have some bruising that's going to come out more later, I think. My cheekbones are certainly barely existing. And I'll have to practice talking. I mean, it's really not that bad, but it's going to take me a minute to learn how to talk with these things. I brushed them this morning, not just kind of a surface brushing, and I took a bath and I what did I do? Oh, I used the mouthwash, the prescription mouthwash, and I used I just kind of flushed my mouth with water. I made the mistake of trying to eat a soft scrambled egg this morning, and it made me almost throw up. I got so nauseous. That's really the other thing, is I've just been really nauseous. I haven't taken any of the painkillers because I'm already nauseous, and I'm afraid it's going to make it worse. And I'm terrified to throw up. I don't want to throw up for sure. That wouldn't feel good. And so I'm just kind of taking it easy, laying on the couch. I slept on the couch last night because I could prop my head up easier. I just had them kind of horsey, a little horsey, kind of red in there, and the bite's off. Good for me. My teeth were bad for so long. I trained myself, believe it or not, I trained myself to sleep with my mouth open slightly, because if I touched my teeth, it would hurt so bad when I woke up. So I don't clench or bite at night at all, and that really helped a lot today. And I think I'm good enough to go, if I wanted to go up to the store to see if I could find something better to eat. The applesauce is wonderful, but I really want something warm. But he told me not to do warm yet. But I want something that's not sweet. I'm not as much of a sweet person as I am a salty person. So I think I might try to make a baked potato, kind of like a stuffed potato, cold and puree it real good. I also don't want any garlic or onion because I'm terrified these temps are going to stink. I don't want bad breath, and I don't have a lot of faith that these things are going to not retain odor. So for the next few months, I'm going to have to be really careful what I eat, just so I don't have bad breath. That terrifies me. I've never had bad breath in my life. Well, not intentionally. Not that I couldn't get rid of. So anyway, I'll let you know what happens tomorrow. There's a good chance I'll be bruised up here a little bit. And I hope I don't swell up again. I hope the swelling is done. So take care, and I'll come back with an update tomorrow maybe. Bye. Again, these are all my temps, top and bottom. 6 implants on top, 6 on bottom.